Hi, I'm Jill Vitale, awesome, with the Eden Alternative. Thanks for joining us today for this Eden Alternative live show. And I'm really excited to have two healthcare insurance experts with us today. We are going to be talking about how do you reduce liability, and we'll be talking a little bit about the fact that you can never completely eliminate risk, but how do you reduce the risk of liability and improve quality of life, especially during this really challenging time of the pandemic. Really excited to have Justin Jackson and Lynette Williams from Healthcare Risk Services with us today. HRS has been a longtime supporter of the Eden Alternative, and if we had our in-person conference in April, you would have met them in person, and this is the next best opportunity. So thank you for everyone who's joining us today. I encourage you to pop in the comment box as questions come up. We want you to be part of the conversation, and this is your opportunity to ask the experts all the things you want to know about liability and improving quality of life. So Justin, Lynette, thanks for being here with us today. You want to tell our viewers a little bit about yourselves and about HRS?
Sure. I'm Justin Jackson. I'm the manager of HRS. My background is in banking and then insurance, but I've been in the insurance industry for about 13 years now, mostly on the agent or production side, as you may, but came to HRS in 2014 and really started the role of, at that time, of helping get the company going with our investors and partners and focusing on what we were going to focus on as an organization, and that being healthcare facilities, communities, with a special focus in long-term care. So since 2014, I've been more so involved on the sales side at HRS, but within the last year, I became the manager of the operation. And so wear those hats, and I'll turn it over to Lynette. She joined us in July of 2019.
Thanks, Justin.
Yes. Glad to be here. I've actually worked in long-term care my entire working life, and I've worked most of those years as an administrator. I came to Mississippi about 15, 16 years ago and worked in a similar role that I have now for our state association for 10 years, and then worked in an Eden home with Century Care here in Mississippi for 5 years. And then last year, as Justin said, joined the HRS team, and this has really been, it's been a good year, but it really, we came into 2020 just like everyone else and with a great game plan, and have had to rework that numerous times. I've been an Eden associate for many, many, many years and became an Eden trainer in 2018. So it's been really fun to intersect all those things together in this role. So really glad to be able to do that.
And I love that, Lynette, that HRS brought you on with your background as an administrator in long-term care, because I think sometimes we think that promoting person-directed approaches is somehow not in alignment with the operational things that make sense, and good business practices and good liability reduction practices. And as we're going to see in this conversation, they all really go together.
Absolutely. Absolutely. And I even a year in, so returning back to this type of role, very, very loudly do I agree with that, because I get to see that every day and bear that out when with the various groups that we work with. So completely agree with that.
So like how many organizations do y'all work with right now? Is it how many nursing homes? Is it mostly nursing homes? It is, right?
Primarily, yes. And so just a little background on that is that we were started by those that are primarily in the long-term care business. And even though we're not restricted to that, that was sort of our foundation, like-minded people in this industry. And they wanted to address two of the lines of coverage in insurance that are unfortunately difficult for long-term care to purchase, whether it be the pricing or the availability, historically the availability, which is professional liability and workers' compensation. So from the onset, we decided not to just be an agency, but also to create a solution, which is our program called Preferred Healthcare Insurance Group, FIG. It's a member-owned work comp and professional liability captive, for more of a generic term, type insurance platform. And so we started HRS and basically FIG, as we call it for short, at the same time. And so early on, we did write primarily nursing homes, assisted livings, independent livings, but since we've also brought in small hospitals, therapy companies, pharmacy, really anything in the healthcare, the four-walled healthcare type industry or operator, makeup, no healthcare products manufacturing or anything like that. So we do have primarily nursing homes in the program and that we work with, so and assisted living. So it would be probably close to 50 by the time you add that mix up.
So you're
in long-term care. So
the organizations that you work with are part owners in this insurance company, right? That's how it works. Yeah, which is great, right? And people work together and you have better outcomes and everybody does better because of that. Am I getting that kind of?
That's correct. And that ownership word will be, I use it a lot from talking about that, even to some of the things I think we'll talk about in this conversation today, how ownership plays a big part in risk management and having a successful insurance program.
Yeah.
For the benefit of everyone that you're involved with in your organization. So
definitely. Well, thank you for that overview. And we can talk a little bit more later in the show about if there are organizations out there watching this, how they could get involved and be part of this as well. So Lynette, like you, I was an administrator for a lot of years, and liability insurance, managing risk, and workers' comp is a part of that. It's a huge part of the job, right? And it's got such a ripple effect on everything. So it's always a focus. And how is this pandemic impacting liability? How's it impacting workers' comp situations? What are you all seeing from the members you work with?
Justin, do you want to talk about numbers or?
I'll give maybe a more kind of a boring underwriting perspective, and then I'll let Lynette speak to more of the risk management and that area. But what it's done in the liability market was it was already a tightened marketplace for long-term care to purchase liability insurance. The cost of it, the cost of defending claims has been going up. Certain insurance companies that previously wrote policies for long-term care, professional liability policies, either restricted the areas or the states that they might write policyholders in, or they pulled out of the market altogether. So it created a short supply in
even prior to this.
Prior to the pandemic, yes. Very, and I don't want to use the word adverse to be too dramatic, but it was an adverse market for long-term care liability. It was part of that cycle over the last 10 years that we were starting to enter, that's continued. And then around March 10th, March 13th,
when the whole world changed.
That's sort of the line in the sand date there, and that's just compounded it from a availability of coverage standpoint. So what you've seen is some carriers, they may still insure and have customers or policyholders within the long-term care industry, but they may not accept new clients or policyholders.
Mm-hmm.
And then you're seeing that some carriers are editing their policy forms at renewals to include a pandemic exclusion. because of the whether they're good or bad, I'm not endorsing it, but it's so new. There's really very little data or ability for anyone to still manage it at this point, because we've still got a lot to learn, and there's been no look back period because we're still in the middle of it. And so it's just would be tough to defend those claims should they come through. Potentially, it could break an operator or an insurance company if it's so severe. It's just hard. Even now, it's hard to track who's responsible should there be an outbreak. And so it's difficult. It would be very difficult for the insurance company and the administrator or the DON to participate in defending a claim due to the pandemic. So there were
when you're saying those things, does that apply to liability coverage and work comp, or is it the same impact on both right now?
It's a similar impact. Workers' compensation did not have the same marketplace environment that liability did for long-term care. Rates were still relatively low, or soft as we call them. Coverage, there were a lot of carriers that would, quote your business, so to speak, if you wanted to look at a different company for your workers' comp coverage. Well, what the pandemic has done there is that it's restricted the availability of carriers. Some carriers will not write new healthcare-based operations. So, if you're a small hospital and you're with ABC Insurance Company, they will renew you. But if you wanted a proposal from XYZ Insurance Company, they may say, no, we're not accepting new healthcare risks. So that's where you've seen it on workers' comp. Payrolls have been down, which that filters through work comp system and pricing. So we don't know really the effect of that just yet. I mean, it's payrolls are down, and premiums would be down for those paying them.
What do you mean payrolls are down? What does that mean?
Well, with the pandemic, I mean, it could be that they've all come back up, but between March and really May, maybe June, what we've experienced is that some communities had staff that either they didn't want to come to work. They didn't.
Oh, you mean actual
other reasons? Payroll. Yes, actual payroll. So
if
they're not there working, and you're working on a 80% than normal staff load, then your payrolls should be 80% down. So is it enough to move the needle, and what would the end result of that be? We're not sure yet.
So is it
can't predict what that's going to
is it fair to say at renewal time that providers out there should anticipate an increase in premiums, and it's harder to shop around because so it's kind of a squeeze that's going to happen?
I would say so, definitely, in liability, and many people listening to this may have already experienced it within the last 12 months, but I anticipate that it wouldn't change in the next 12 months. I mean, I think the expectation should be that liability terms, conditions, premiums would be a little more difficult than they were previously. So,
okay.
I don't want to be the bearer of bad news, but that's the reality. And COVID-19 has compounded the situation we were in.
Yeah. Well, I think if it's going to happen, it's better to know ahead of time than it is to be surprised. After you've already done your budget and done all your planning, it's good to know what's coming, even if it's not pleasant. So Lynette, any other things you want to add on that with what we're seeing with the impact on liability, work comp?
Yeah, I think that, I find it interesting, but the word safe has been the word. It's like during the season, being safe. And so I think that's meant some different things. So I think it has created some complicators. It has had some positive sides on the reduction, particularly like on the work comp side. I think that there's been such an emphasis on safety in general, that's been somewhat beneficial from the standpoint of just being more mindful. And we know that prevention of particularly like work comp claims, that's one of the biggest things to work on, is just getting all staff to be mindful in their work processes, to try to prevent, any type of incidents from occurring. I think that one of the biggest challenges then on the liability side has been this hunker down, shut down situation that we have found ourselves in. And it's really brought to light the critical nature of our communication with one another, whether it's within staff ranks or whether it is particularly like with families. And I've just watched this with a lot of different people, and it's called upon everyone to be just very creative, as well as finding lots of different ways to communicate in ways that say we're caring for, not that detachment that creates such the problem in liability issues. It's so interesting to me in working with this now. I'm into my 17th year, I guess, specifically in this type of role, or 12th or whatever the number is. But anyway, the distinction between really bad incidents that can happen that go nowhere in terms of legally, and then sometimes really good care that is even really well documented that does move forward. So I think that that's where the communication piece is the only way to explain a lot of that, and the connectedness. And of course, Eden Homes, that is what Eden Homes are about, in terms of, and it requires that constant work and processing with all of that. But that has really been challenged, I think, in this environment. Just trying to maintain those communications that will keep the first, thought being, well, I'm gonna consult an attorney, or I'm gonna request the record, or I'm going to, it's really distrust at the core of that. But for homes who are on an Eden journey, as an example, there's such a commitment with that day to day, as people have been able to visit and be present in homes, of having those strong connections and those strong relationships. So I think it's really gotten complicated.
It's simple yet complex, right? And that's one of the things that I saw when in my old community, when I was implementing the Eden alternative, is prior to that, there were all kinds of complaints made to the state, right? Which is kind of that. And then the next step is I'm going to call an attorney. There were people calling the hotline and just not going well. And once we started really focusing on communication and being well known to each other, right? Family members and team members and the elders that lived in our communities, there's trust. And people don't, my experience was, and I think you see this in the numbers, right, is you don't go to the bad place right away if you know people and you trust them and you feel like you're part of things. And right, and what a challenge it is right now with family members not being allowed in, and all of a sudden when there isn't trust, it escalates.
Yeah, that's right. And just you think about what people are exposed to out in the community in general. They talk to this is a work comp issue as well as a liability issue. You talk to your neighbor and, oh, well, here's what you should do. Or if you turn on the television and there are ads and this kind of thing. Okay, so there's all the countering of that goes on routinely, but it's really what happens in regular conversations, and just you mentioned not being known and those processes that happen. But it's so hard to do that arm's length and from a distance.
Yeah.
And I think that's just been a huge, huge challenge. It's phone calls in lieu of that face-to-face, and I just think it's really created the distance has been so real. That's just been extremely real. The world's talking about 6 feet, and I'm telling you, that's a really real thing with this. Yes.
Absolutely. So I'm curious if you've heard of any what some organizations are doing to keep that communication going. Do you have any kind of best practice suggestions for organizations right now? Because I think thinking back, Lynette, and I don't know if you feel the same way, is like we're under siege. And when you're under siege, you take cover. And I know what's best, and I don't want to talk too much, and that can backfire, as you just explained. So what advice do you have?
Well, what I've felt happening is we've kind of gone through some stages, since, as Justin mentioned, mid-March. I literally, March 11th was the day the president spoke. And, never in my career, and that's been a lot of years now, has there been something on a international, global level that has been so pointed at long-term care. Just front and center, from the beginning. And so I think that I think we've gone through stages with this, and what I've watched happen is growing in some comfort and growing in some confidence of putting measures in place. It's kind of a do all you can, which is all you can do. And honestly, I have found myself saying that very often to our folks during this time, because it is super overwhelming how not preventable this problem is.
Yeah.
We want to talk about risk, but we do all that we can. And I'll tell you something else that this wasn't mentioned just a second ago, but you think about the connection between staff feeling empowered and ownership, and then what they're doing when they walk out the door. You know that there is a strong connection with that. If they're highly invested in that home, and they are, they know how important they are in that home every day, that's going to temper their decisions as they're out in the community and about the things that they are doing or not doing. This has been sacrificial, let's call it what it is, on the part of many, many, many in the army of long-term care folks, because they've had to make decisions to not be present in some places that maybe have brought them great joy, or that they, good, bad, or otherwise, and in order to keep folks safe that they're taking care of every day. That doesn't happen outside of strong relationships and the fact that they're empowered to feel ownership in that home. It doesn't.
Absolutely. And know, like you said, how important they are. So, that's interesting. One of the things that, and this was obviously pre-COVID, but in my community, after we had started implementing the Eden Alternative, I remember one safety committee meeting, and we had a whole bunch of back injuries in this one neighborhood. And I went into this meeting and I'm like, leadership is going to have to figure this out. And I go in, and the nursing assistants, direct care partners, and the nurse from the neighborhood were sitting there, and they said, we figured this out. It's because we weren't communicating and getting someone else to help when we had to, assist an elder where we needed help. And we figured out that the problem was we had some unresolved conflict, and we've worked on it, and we've got it figured out. And the back injury stopped. And I was like, that is just, that's empowerment, right? Is owning it and wanting to keep their team safe and the elders safe. And leadership doesn't always know the answers. Usually it's not formal leaders that have the answers.
How true. We're going to, this fall, we're going to do a webinar with our work comp partner on safety committees specifically. And, I think safety committees, that's such a great example you gave, because safety committees have been something that are kind of real overly structured and, that kind of thing, when really that's what it's about. It's just getting folks in the same room that all have the information and the experience to just have the conversation that then says, here's how we can better the situation, fully prevent or just make it better. And so I'm looking forward. We're going to work on that with all of our group, this fall.
Great.
I feel good about that, and almost like redefining safety committees. It's not a thing to just check your boxes off and This is something that has real potential to have positive outcome.
Absolutely. Definitely. Justin, any thoughts that you have on best practices right now?
Yeah, I mean, you guys are onto something that I would drive home is that I learned this a long time ago, work comp or the situations you get in that can cause you a work comp injury or accident, whatever you want to call it, is all caused by behavior. Primarily, you could have some conditions that were unsafe, but typically it's behavior. And so if you can change the behavior, and we're not talking about changing the behavior of a little 3-year-old, we all have our actions speak to that's how we're behaving at the time or in that situation. And so if you can change the behavior in a situation where they should have been communicating, taking just a few seconds to think about the situation, I need to ask for help here. I need to get over the fact that she and I aren't really close or we've got some issues. They change that behavior themselves, and then by doing so, they change the culture of that part of the community or their team. And so if you can change the behavior, if you can educate and train with the goal of changing behavior, you're going to change your culture, which then you'll see improvement with risk prevention. You know, it's not to say you won't prevent all accidents from occurring, but you're going to minimize more so than you did when your culture wasn't so great from that standpoint. And so what we found is really if you can allow your team, your staff, your people to feel empowered or have ownership in the process, then you've got this great subculture within the kitchen or dietary people within your community or your maintenance people or your CNAs, LPNs, RNs, and so they will self-police, so to speak, about safety. And what we found too is that that's not just a work comp issue because the things that injure our staff also can injure our elders, the people that we're caring for. And so there's a lot of synergy in things that you focus on to prevent injuries or loss by addressing the behavior. So you've just improved your liability risk and your workers' comp or worker safety. So,
and then you save money that then you can use for other things in your community.
Correct.
Right? Like make life better for everyone.
Tools that you can. That's right. That's right.
Yeah. Yeah. That cycle, right?
That's right. It's a cycle for sure.
That's awesome. So I want to invite people who are out there watching to pop in with any questions you might have or comments. We would love to hear from you. So Justin, you said something, and this is kind of going back to what we were talking about earlier, but I want to just really highlight this. You said that you don't hear families suing nursing homes. They're not the same people that say, I love this place and my mom loved living here. Like those are not the people that open up a claim, right?
Right.
So what's that all about?
Well, and I think it's something that Lynette was talking about earlier, and I maybe would have added there, is that the relationship that we have with those that we take care of in a long-term care facility is not just, I guess you could say it's for selfish reasons that you develop a relationship and have a good relationship with that person and their family. But typically, we're going to have falls. We're going to have pressure ulcers. We're going to have situations with medicine or food or just things that happen within the community. You can't prevent those to 100% rate. Okay. But what you do before an incident happens relationally, I think the way you communicate, the way you take care of them, the things we've talked about from good behavior and good culture carry over to post-incident, which is kind of the unknown time is, hey, this happened. Are they going to file a claim or are they not? When you have that connection and the family knows that their mother loved the people that took care of her, loved living there, spent if that was the remaining years of their life, they were the best that they could have hoped for and wished for their loved one, then typically you can manage that relationship if an incident occurs to the extent that they won't take that action. A lot of times what could drive a claim could be some sort of frustration or resentment that had built over a period of time with the family. That's not to say that you can't get through to some people to the point where they wouldn't do that, but you just typically don't see that. Rarely in those type situations is it that they had a really close relationship with the people that took care of their loved ones.
Right. One of the things that I've been thinking an awful lot about is having family members as well as residents be part of the solution with things, right? And so, I always tell this story about the place where my parents live, and they had the leader there. It's called Holly Creek, and it's here in Colorado. And the leader there at the time had realized that workforce recruiting and retention, she realized that what people love about working in a community is the residents. And she realized that she was kind of trying to fix this whole problem of employee recruiting and retention by herself with her leadership team. And so she involved the residents and shared all of this is how hard it is to get people to work here. This is what we're up against. This is all the things we're trying to do. And they started this committee they call it the Keepers Committee. And it's really about the residents playing an active role in keeping team members. And, having dinner with my parents when the server was goofing things up. And my mom said, you know what? Our job is to help her be successful here. Versus in the regular way of thinking, right? It's, I'm going to write a complaint card and the executive director needs to fix this. And so I keep thinking about that experience and just how it just became part of the culture, is that family members can be part of the solution too, right? Like, how can we not, there can tend to be sometimes an us and them, but how do we make it a we and all work together to try to make things better, and maybe family members can understand some of the unique challenges that you're facing in a more transparent way. Mm-hmm. Does that ring true to you? Does that make sense, or am I crazy?
It really does. Lynette?
Yes, absolutely. And I think too, one of the things that it's also about really persevering a good bit, because relationships are not born usually real quickly. I mean, these are difficult days for families, not just amidst the COVID pandemic, but I mean, in general. And that's just compounded things, in terms of their stress and concern and, that kind of thing, especially when you think about how targeted this pandemic has been for elders. But I think that it's about persevering. In my role and in my communications now, I find myself circling to that a good bit, to remind that it's about staying with, it's about not, it's a lot easier to walk away from hard communications and people that are difficult and demanding than it is to hang with them and to continue to persevere in that. But I really, encourage that, because honestly, that is the only way to kind of move forward with that. And, a lot of times then when you look back, you may still feel like the relationship is difficult, but yet it has moved forward some, and I think that's where trust is really born as well, is in staying with that communication. And that sometimes when I will be, working with a particular home, and maybe you can sense as I'm working with the staff, you can sense them kind of beginning to retreat. It's like, okay, and I get that because I have been there many a time, but the worst time to retreat is when people are, they're feeling really vulnerable and they're feeling very defensive and they're communicating that, but we have to then just stay at that, because ultimately more times than not, we will win people over. at the end of the day, they are entrusting their loved one to this home. And so we have to remind ourselves, this is a good work. We're doing a good work. And ultimately, those folks know we're doing a good work. We've just got to continue to press into this. So I think this is part of the approach that we work with. That doesn't sound very structured risk management, but that is really at the core of what will move towards preventing people from, pulling the trigger on whether it be a complaint, as you were mentioning, that has to be reckoned with, or obviously then going to an attorney.
Right. And it really, it's the whole concept of care partnership that we talk about in alternative, that it's everybody together, including the elder, including family members, supporting that person. That's awesome. I love it.
Sure.
So, question for you. One of the things that we find when we work with different organizations, especially when they're just getting started, when they've been in it a long time, they kind of start to understand these things or see things a little differently, but that there's this, you can't promote person-directed care without, you're going to end up violating regulations or getting sued. And I'm sure you've heard those things too. And there's this whole, my old CEO, when I was at an organization that had multiple communities, you'd say, you know what, it's called risk management, not risk elimination. And if you try to, and it's that whole concept of surplus safety we talk about with the Eden alternative. So how do you help organizations? What words of wisdom do you have for organizations about that, about supporting what are sometimes risky behaviors that elders wish to be part of? Thoughts?
I think that part of it is sometimes giving enough thought to the lines of what's going to happen here. Like, what are the potential outcomes of not allowing a behavior? What are the potential outcomes of allowing a behavior? If you think about it like that, like what are if we're on a road here and there's some decision to be made, I think that it's about really being able to think that through and process that through. Because honestly, if people will think along the line, even if they'll have conversations with maybe homes who are further along in their journey, that's a really important thing to do. Because what you're going to hear repeatedly is, whether it's the Eden journey or not, making those choices. This is what the world at large has figured out, is that person-centered, focusing on the individual and what works for that individual has become more of the demand of our world and what people want. We see this begin to shift generationally, that this is no longer like really, it's not really a choice anymore about whether that's the way to operate. But also, instead of pushing back on that, realizing that it works. It's the right thing to do. It is the thing. Part of this, I think, drills down into that age-old question of how we want our own grandmothers or mothers, or I'm getting closer and closer to how do I want to be treated.
Right. Well, I'll be there.
It's a thing of being willing to do some soul searching on the thing and realize that that may sound a softer approach than looking at dollars and cents, but honestly, if people will do the work to talk to providers, they will realize that the money follows. The money follows, the approach to say that not only is it the right thing to do, that it works, and that you get all of these wonderful outcomes that you're not even bargaining for, such as staff ownership and some of the things like we've talked about today in this conversation, that then it also will have a positive impact, financially as well. Everyone's dealing with regulations. That's not going to go away. It's not like you take some road and then you're not focused on that. But it's beginning to see that the the focal point, if the focal point is doing the right thing with and for the person, then all of that's going to begin to mesh and move together. And, as we've talked about, I mean, I've been in a lot of situations over the years, both on the operational side as well as in this type of role, in which that appears to clash, but if we'll stay with it and we will continue to press ahead, we find pathways then that work both for the elder first and foremost, which is the point, and then also have positive outcomes for everyone surrounding that. So, it doesn't have to be it's not an either or. It does not have to be an either or.
And so the organizations that you all work with, so if I was at an organization and I was like, I don't know what to do, are you the person that you would help people through that, figure things out and look at that, and how do you minimize risk without, is that an accurate statement?
Yes.
Yes. Yeah.
So I wish that I had known you years ago, because to have somebody that understands, especially if you're really trying to do things differently, and have someone with an insurance organization that's like gets it and isn't just about trying to eliminate all risk, and really come to some solution that's very balanced and supports the good things that can happen when we take risks. That's pretty incredible.
And we have too, we want to, as you would appreciate, from our perspective here, mine, and I think Justin would agree, is that we want to take all of the resources that we have in and surrounding HRS and make those available and move forward together with that. That would mean that the entities that we work with that bring different resources to the table, both on the liability side and the work comp side. I work with them in a kind of partnering way, is the way I think about that. But also with all those who are involved in our program. I mean, there is a well of resource within our program that having walked through so many things over the years. So since I have known them for a long time, I just, I don't really think about that sometimes. So thanks for the reminder. That's part of what we have available as well. But yes, that's the kind of role that we want to have. Those are the folks, Jill, that we feel are like-minded to our program, that they want to come together and be transparent together and work towards, problem solving, and how can we move forward together? What do we know from another provider? I mean, all of those kind of things.
That's great. Thank you, Lynette. Justin, anything you want to add on that?
Yeah, just quickly, I mean, the situation you presented is not any different than what you would see with any business. So, if I have a customer that's in the, I'm trying to think of an example, some type of construction business, okay? And then all of a sudden they call me and say, we want to open up, we want to start performing, start working on bridges. We were a dirt work contractor, and now we want to do dirt work in conjunction with bridge construction or something of that nature. Well, we don't just say, okay, you have liability insurance, so you're good to go. It's what Lynette said at the beginning there. It just takes some thought. Okay, so what's the risk in doing that? Well, the risk is that, and really what risk is, it's a situation involving danger or the chance to lose something that's valuable to you or to be damaged. So, all right, what could I lose, or what could I be exposed to danger in doing that? Whether within a long-term care community, it's a field trip somewhere for those that can attend. Okay, let's identify the risk involved with that. What could go wrong? And then kind of assess that situation, analyze it, and then say, okay, we feel, and then talk to us and say, hey, do I have permission to do that? Not necessarily, but I'm being facetious a little bit.
Right.
But you better ask our permission. No, but because we can look at it through the context of, would this put us in a situation that would either cause us to not be eligible for coverage anymore, or to, maybe from our experience, we've seen situations similar to that caused a claim that could have been avoided. But if it's something that we feel that we could take on or start doing or allow, then we just do what we can at that point to reduce risk or reduce the chance of something going wrong. And then once we start, we monitor it. So, but it communication has to be a part of that. And
if somebody's really going off and doing something totally different, you mean it's like that partnership of how do we?
Yeah, I was kind of a little extreme, or maybe broad and extreme on that. But you see where I'm going. It does take some communication and thought. It doesn't mean that you can't do things differently, or
so are
open
you,
the door to this.
I'm curious with hearing you talking. So are you like organizations right now, these nursing homes that are problem solving? How do we have visitation of families and minimize the risk associated with it, but like figuring out a balanced solution? So things like that, you all can talk through, get your community together of other organizations you work with to think through some of those things. Accurate?
Yes, that's going on. Actually, among our group, the group in their own communications, I joined that, at different, so there's a lot of communication going on about that and trying to share any, a lot of, is it working? How's it working? And also, is it having positive outcomes?
That's great.
Yes.
That's great. I remember, and I'm sure the organization I worked with, the insurance company, was great, but the only time I remember communicating was when we had a notice of a claim. Or I was nervous about one, and I love the proactive approach. And I'm sure there are other ones that do that, but I love hearing, especially with your focus on well-being and quality of life too. So how, if somebody's watching, right, and they say, gosh, I'd like to learn more about this, especially the fact that you actually, your organization can be, if I'm getting this right, an owner in this, and if when things go well, you do better, right, financially. Mm-hmm. Are you still accepting new organizations, and what's the next step someone would take?
We are, and so just not to go too far down the rabbit hole on technical insurance terms, we have within our program, Preferred Healthcare Insurance Group, we have reinsurance partners who also provide the policy paper, as we call it, for our members. And their liability is called ProAssurance. Work comp, it's Eastern Alliance. ProAssurance owns Eastern Alliance. So they're our partner in this, along with the members and HRS, and those two entities are the partners within that program. And so both of those carriers still will write policies for healthcare, and including long-term care. So that's a roadblock that's not in our way for our program, because we sort of we have to follow the guidelines of what they can do within the states that they're filed with the various departments of insurance. So we're good to go there. There's no restrictions on new healthcare providers, senior living, long-term care. So we're still looking for members that are like-minded. I mean, really, the Eden Alternative fits what we set out to do. In fact, just independent of my relationship with Eden or HRS's or Lynette's, our underwriter at ProAssurance asked me about Eden, and he asked me if we'd ever insured or communicated with Eden Alternative Facilities about our program. I said, well, a matter of fact, we have and do. And so I guess the Eden reputation is out there, something that's desirable in this marketplace, and that's a good thing. So I mean, I think the ground is fertile, so to speak, for communities like those that are part of Eden. And I mean, we certainly have always been behind what you guys are doing, and have always felt like it's the type of communities and facilities operators that we would want within our program because of what we promote, and because of the things that you do that at the end of the day, do help provide a good underwriting outcome. And that's to the benefit of everyone. So, I mean, that profit share that you may get out of ownership in the insurance company sort of insulates you from the swings in the market. You know, you don't have to look at bid and quote every year, which can and does take up a lot of time.
Yeah.
Maybe stress within organizations. And so you have a chance to earn some of those expenses back. And like you said earlier, it does go to the bottom line, but that also provides tools for you to have at your at your disposal to upgrade things, give your employees more resources that they can use to give better care and help your organization overall. So that being said, I mean, we're looking for members like those that are in Eden and would love to talk to anyone that's interested in having a conversation with us. And no commitments by doing that. We can, back, Jill, I think I shared with you, we could even do sort of a group study for Eden facilities where we just get some basic information. If we've got 20 or 30, 40, who knows how many different locations, and say, hey, this is how this group stacks up in the marketplace. And
yeah, that'd be great.
You know, something you can take advantage of. So, I mean, I can certainly contact me. I sort of still serve the sales and first point of contact for prospective members. So they can reach out to me, I guess, if my information's there already shared with everyone, but email me or call, or Lynette.
What's your email address, Justin?
justin@hrsins.com. Justin at hrsins.com.
Okay, and it's in the comment box too. So Justin at hrsins.com. And then your website is www.hrsins.com if you want to go and check out Healthcare Risk Services website. So Justin, Lynette, thank you. Is there anything else you wanted that we didn't talk about that you wanted to talk about?
Glad to be
Thanks
here.
for having me.
Yeah, everyone's doing a good work. That's great.
Well, I really appreciate you being here, and thank you for your ongoing support and partnership with the Eden Alternative. And thank you for helping organizations to manage this really, it's always challenging, but an even more challenging time. And for those of you out there watching, thanks for being with us today. I hope you will also join us next week, August 24th. If you have seen the news about, it was in People magazine and the Today Show about Mary Daniel, the woman who got a job working as a dishwasher in her husband's assisted living community so she could see him during the visitor restrictions. Mary's going to come on our show and talk with us. And since that time, Mary has really been catapulted to the international stage. She started a grassroots group called Caregivers for Compromise, and it's thousands of family members from all over the country that are really working with state and federal leadership to find a new path forward for family member engagement in communities because they are extremely concerned about the isolation that their family members are experiencing right now during the pandemic. So please join us next week for that show with Mary. And thanks you all for being here today. Thanks, Justin. Thanks, Lynette.
Thank you.